Good morning. I will be discussing national health care. The coronavirus pandemic of 2020 has turned the world upside down, along with our everyday living, and now a new focus on health insurance, as this virus has caused an uproar with insurance coverage for hospitalizations, deaths, and unanswered questions pertaining to it. Globally, people have had to deal with major changes from businesses closing, delayed healthcare services, nursing case overload and burnout, virtual learning, and major anxiety because of this virus. The United States has a national health care plan called the Affordable Care Act. It was put into law into March of 2010, and it was created to make health insurance more affordable and available to people. It requires, excuse me, It requires health insurance companies to spend a minimum of 80% of the premiums they collect on medical care or improvements to the medical system. It also removed the pre existing conditions that insurance companies were using to deny services to people who really needed the help and can receive care and treatment. The cons of the Affordable Care Act is that it raises the cost of healthcare insurance for Americans. Access to doctors in some communities are difficult to obtain. Many private health insurance plans were canceled because of this Affordable Care Act, and it increased the medical expense deductions for families. Before the ACA, there was a health insurance plan called the Catastrophic Plan. The catastrophic plan was a private insurance plan that had low premiums with high deductibles while protecting you from serious medical debt. Because of the high deductible, you would have to pay out of pocket for every service that was outside of preventative care. The catastrophic plan covered your basic and preventative services. It covered 3 visits a year, some prescription drugs, and some birth control. Unlike the ACA, an individual did not receive a penalty or fine for not having insurance for an entire year. The catastrophic plan is only a good plan to have if you really get sick. This is a good plan for young adults 30 and under. In comparison to the next, Canada Canada doesn't have a single national health plan. Instead, they have 13 provincial and territorial healthcare insurance plans. Canadians have access to medical and physician services without having to pay out of pocket. In Canada, citizens can freely choose the doctors and hospital of their choice and needs and keep them. Taxes are much lower in the Canadian health system. There's also a downside to the Canadian Health Act. There can be longer waits for non-emergency procedures and wait lists. Patients in different regions receive better services. People in rural areas may not be covered as well as people that live in metropolitan areas. And also, government interventions tend to lead to politics and healthcare decisions. There's a survey that I took and gathered information of how satisfied people are with their healthcare plans, knowledge of the catastrophic plan, and how they feel about steadily increasing insurance premiums. Of the people surveyed, most were satisfied with their healthcare plan coverage. They all were dissatisfied with the increasing healthcare premiums, stating that it's hard enough to afford the premiums due to its increasing prices. All of the surveyed agreed that there should not be any copays before services are rendered. Not too many people of the survey had no prior knowledge of the catastrophic insurance plan. I'm glad to have shared that knowledge of this information for people to further explore this topic at hand. Overall, the American and Canadian healthcare systems are both similar and different in providing care and to help cover the costs and services and procedures. There's always room for improvements in both healthcare systems to ensure equal healthcare for all people, no matter what class tax bracket you're from. Thank you. Now that's